Just a note I wanted to add in before I forget. I had October 2022. I had, uh, October 2021. I was leaning over a Halloween pumpkin. I hurt my neck. This is after I was already having problems and I was fragile. And then I started having grinding. Like every time I turned my head, I'd hear grinding in my ears, and I'd feel grinding around my C1 area. And I just thought I was going to have to live with that the rest of my life. And then I had some injections at a place called Peak Health, where they kind of inject around the general area of your spine, and they didn't really use fluoroscopy. And I asked them to, but they were going to do it without it because they're just like, well, we just inject the general area. And I was like, I didn't know anything. I was like, that's okay. And so they did that, and it helped some. Like I definitely felt stronger. So there's some merit to that, injecting the general area of ligaments. Um, and Though I think you should legally be required to use fluoroscopy for injecting the spine, just period. Like you're going to inject within like an inch of the spine, anything, okay, you have to use fluoroscopy. Even if it's just an ultrasound, right? You have to. Like that, it should be legally required except in emergency purposes. There's no, why wouldn't you? What if someone has some abnormal physiology? What if something's going on? Like you need to know. Also to prevent errors. Like you need to know. And so that's crazy that they wouldn't do that. But anyway, so it helped me feel stronger. It didn't resolve that grinding, and so then when I got posterior PRP at regenexx, which was 10 times concentrated, versus theirs was 4 times concentrated at Peak Health. But also, they specifically inject the ligaments, and then the grinding went away. Like in a week or two, it was gone. So, like, but Dr. Papas in Tampa and everyone at regenexx, they inject your ligaments specifically because the main problem is not blood in the area of the ligaments, but blood getting into the ligaments because there's just poor blood flow in the ligaments and tendons. But in the case of spine, I'm just dealing with ligaments. So yeah, that's that helped. So that if you're thinking like, does it matter? There are some places that are cheaper. Can I go there and like they'll just inject in the general area, or maybe they're not using fluoroscopy. It's like it matters. Like it really, really matters. And if it wasn't for the expense, everyone would go to regenexx because why would you go anywhere else? So that just goes to show you like the expertise, and that doesn't mean only regenexx. Like there's doctors that are trained similarly to doctors at regenexx, or trained by doctors at regenexx. Like I think there's someone out in Atlanta, I forget, that runs his own private thing, but he was trained by Dr. Centeno, and he does just as good. I mean, he does, leading industry standard stuff, and it's not through regenexx, but it's also similarly priced to regenexx. So there's just something to consider. Like if you want to go cheaper, then but there's also something to consider too. I think that regenexx might not consider is that injecting general areas around ligaments can also help. Like I felt stronger, faster going to Peak Health, but I also developed a hissing tinnitus when I went to Peak Health that regenexx did not do. They also did prolo on me first, so that the hissing tinnitus started after prolotherapy. So it might have just been that I didn't react well to prolotherapy solution, whereas blood is just my own, PRP is just my own blood. So there's that too. And a lot of people get prolotherapy at Peak Health and don't have that issue. And there are some people that get PRP and have done so at regenexx and have developed tinnitus. Like I asked on Facebook, like, hey, Anybody else get any kind of like hissing in their ears after getting posterior injections? And someone said they went to regenexx and then started getting hissing tinnitus in the ear and had it for several months since then. They're hoping it goes away, but I said, "Do you tell the doctor?" And they're like, "No, because I don't know, whatever. I just didn't want to. I don't know. I don't know why they wouldn't tell the doctor." But yeah, so that's another potential thing like people don't talk about. Is it like I've seen people get tinnitus from posterior injections. But I mean, like, you're talking about this is the last line of defense before you're doing fusions. So I've seen people die from fusion. I've seen people become paralyzed from fusion. I've seen people have painful neuropathy like in their hands because of fusions, just where they just burn all the time and itch all the time. So it's like when you're dealing with that part of the spine, I think regenerative therapy is vastly superior to fusion if it can do the job. If it can't do the job and you got to do fusion, then you got to do fusion. But if you can't, so anyway, I wanted to say that, put that information out there because I never talked to anyone that knows about it, and it's important.